There's a slight burning sensation. I guess probably similar to a less intense version of sticking a 9-volt battery on your tongue. I think I was just looking at alternative therapies. The medications had so many side effects, and I was looking into various methods of treatment.
We can achieve the same thing without a chemical or without a drug, but much faster just by stringing information from a smartphone to a device you wear on your head.
I'm curious as to what it would be like to change aspects of my own brain for very short periods of time. Don't try this at home. My mother was diagnosed with bipolar disorder, and I lost my aunt to major depression. So that was suicide. And then myself, diagnosed with bipolar at age 19 after being diagnosed with major depression from age 15.
Very nice. Really nice, actually.
It's a roller coaster ride. So emotionally, pre-therapy and medication, I was either starting 1,000 projects or drinking a lot or unable to leave the bed some days. A couple of suicidal ideations as well, so emergency department trips, and yeah, it has been quite debilitating in my life.
You have to be strong-minded to be able to live with somebody that does suffer with depression in such a big way. It's been hard. It's not been an easy road for myself as well, but I don't think that that is anything near what they go through themselves.
I've been through the gamut of antidepressants and mood stabilisers, and I decided to try transcranial direct current stimulation as another method.
Okay, all ready to go? So I'm just going to start by measuring your head. That's great. Just put your finger there for me. So this relatively new form of brain stimulation, which we often call direct current stimulation, involves a tiny current. It's the kind of the size of current that comes out of a battery. So we're just putting on the electrodes, and you can see it's got the orange sponge, which we've wet here. Direct current stimulation is used for a number of things. One is treating people with psychiatric or neurological disorders, so things like depression, that's been one of the big areas, but also by neurologists, people having rehabilitation after stroke. So what's happening here is that the machine is now delivering a tiny current between these wires, so it goes in here and then back out here, and we're actually very gently changing the resting state of the brain cells. In a typical treatment session, we would leave this on for 30 minutes. We're always with the person, we don't leave them alone, because if they have any problems, then we need to be there to respond.
The Black Dog Institute runs clinical trials using transcranial direct stimulation, also known as TDCS, to treat bipolar and anxiety. Lee participated in one of these trials.
I was really quite impressed with the technology. The results showed that I had improved both in my concentration and in my memory.
Transcranial direct stimulation, or TDCS, is not yet available as medical treatment outside of clinical trials. Lee wanted to continue the treatment, so after months of research, he bought a TDCS device for about $500 for home use, off the internet.
Basically, electrical current flows from the electrode on my head and into the other electrode. So and the path that it takes is literally through the brain. It actually happens through the frontal lobe that I've placed it over. So that area is associated with attention and focus and planning.
It does worry me a bit. There is not another therapist that is controlling it or monitoring it or watching it at the same time, and I think that is a bit of a concern.
People are so excited about this that there's now an emerging market in the kind of do-it-yourself brain stimulation. I'm just going to put the cap on your head. The brain is a very complex organism, and there are very complex relationships between the type of stimulation, the level of stimulation, what size electrodes should you use and where exactly do you put them? Because we know that, for example, if you have 2 electrodes, I put them here and here, or if I reverse them, you could have the opposite effect. So I'm not sure when people do it at home what they're actually doing.
But brain stimulation is not only being used for treating depression. Some are exploring how stimulating the brain can enhance our ability to focus and learn new tasks. Peter Simpson-Young is a recent neuroscience graduate. He uses TDCS frequently as a means to enhance concentration.
Yeah, it's only safe if you know what you're doing, and no one knows what they're doing unless they've fairly qualified. So my motivations aren't cognitive enhancement, they're self-experimentation. There's a big push in the US for TDCS as treatment for depression at home on a prescription use basis, and they've done a lot of work, a lot of publication around that, and I suspect that will be a big thing.
Brain stimulation was popular in the 1950s and used to treat depression through electroconvulsive therapy or ECT. The patient is under general anaesthetic while a doctor sends a current to the brain to induce a seizure. Side effects can include memory loss, brain damage and nausea. ECT was controversial and went out of fashion for decades. But now brain stimulation is coming back, and in a very different way.
With ECT, we give a stronger stimulus while you're under anaesthetic. And it is a very powerful treatment for severe depression. But it's not something that we would do lightly. Transcranial direct current stimulation is different again. It's a very gentle, low-level form of stimulation. In a few years' time, we might be in a position to say, we've now done a number of research studies. TDCS is a proven treatment for depression. And because TDCS is fairly cheap as a technology, it's fairly portable, I think, potentially in the future, this could be quite a good kind of ongoing, top-up or maintenance treatment that you could do, say, once a week, to try and stay well.
The Think device is about enabling consumers to change their mental state on demand. We can essentially shift people from normal state to a relaxed state or a normal state to a more energized state within a matter of minutes by streaming information from a smartphone to a device, small device they wear on their head. The technology has been around for more than 40 years using electrical stimulation for consumer purposes. We are just now taking it to the brain directly.
Dr. Jamie Tyler co-founded Think in 2011, having worked as a neuroscientist for 2 decades. The startup has offices in Boston and Los Gatos, California. The company created a wearable brain stimulation device that, they say, lets consumers change their mental state to calm vibes or energy vibes.
We don't send currents directly into the brain, we send them into the nerves that underlie the skin. And through this pathway where we can modulate the brain without doing anything harmful to it. In fact, our device is not intended to treat a disease or diagnose a medical condition. Whether people are using it off-label or not, I can't say. We have heard no reports of people using it in that manner.
With some of the devices on sale, there is very slick marketing. I looked at the websites and I must say they look very attractive. You have all these beautiful looking people with the device on their head. If you want to stimulate your brain, that's up to you. I guess a little word of caution is that what you're doing is not trivial. With repeated use, you can be making profound changes in your brain functioning, even within the recommended parameters of, say 20 minutes once a day. But what happens if you do it for a month, 2 months, 6 months, 2 years, 3 years? Is that safe? Are you making irrevocable changes in your brain that may not be beneficial? We actually don't know.
I have trouble believing that I'm going to, in 40 years, have some detriment because of the occasional application of milliamps. If it does come out that TDCS has long-term negative effects, then I'll only have myself to blame.
I feel there could be some problems. I don't know whether there's been enough research into it. In saying that, When I look at the amount of drugs that these people take to try and counteract their depression, and if there is another solution, maybe that's a good idea.
I do think that over time people will gravitate towards this. Technology is more natural. You're using your own body to achieve something that you want to do.
I really do feel that it is worth the risk. Depression is a real life-threatening illness, so should it ever come to the point where I have suicidal ideation again, it may be a way of removing that.